I'm not audible. Okay, do you want me to raise my voice? Okay, I can do that. So, very good evening all of you. So today we have few multiple choice questions from oral histology and general pathology, right? So we have a set of 5 questions. We'll discuss them real quick, and this is going to be a short live session, right? I hope you guys are ready, and I'll be posting all the questions in the chat box so that it will be convenient for you to go through the questions and answer accordingly, right? So is the voice audible, or do you still want me to raise my voice? Anyways, you need not worry, because as I said, I'll be posting the questions in the chat box, right? Yeah, very good evening. Simarjit, how come I'm wearing a jacket? Because I'm out of country, I'm in Australia. Yeah, sure, I'll definitely raise my voice, because it's almost 12:50 a.m. midnight, so I'm trying to put my voice low, but anyways, I'll try to raise my voice, okay? But as I said, you need not worry, I'll be posting questions along with options in the chat box, right? So once again, a very good evening all of you. So as I said, we'll have multiple choice questions from oral histology as well as general pathology, right? Yeah, sure, I'll try to increase my voice. Yes, I'm trying to put my voice low intentionally, but as I said, I'll try to increase my voice. Okay, we'll have our first question. Hi Pranav, very good evening. Okay, the first question, plexus of rash cow is formed by which of the following nerves? Myelinated, non-myelinated, both, none. So you can see the question in the chat box now, in the comment section. So also I'll try to raise my voice, okay? So the first question is, you might have heard of various nerves in pulp. We have different kinds of nerves based on the surface structure that's present, that is myelin sheath. So we have myelinated nerve fibers, non-myelinated nerve fibers. You might have heard of plexus of Rashko. So what exactly is this formed from? Is it a derivative of myelinated nerves or non-myelinated nerves? So that's the question. Yeah, plexus of Rashko is formed by myelinated nerves, non-myelinated nerves, both, none. And before we proceed with our session, as I said, just make sure that you have your customized notes, and see to that you have your customized notes for all our discussions, right? It can be study club discussions or live sessions or whatever. So try to have customized notes, and see to that you enter all key relevant points which are part of our discussion simultaneously or after the session as per your convenience, okay? Yes, myelinated fibers is the right answer, and there is some interesting information pertaining to this. In fact, myelinated fibers, they lose their myelin sheath and form a plexus, right? That's nothing but plexus of Rashko. Just try to keep this point in mind, right? So myelinated nerves is right answer. They lose their myelin sheath to form plexus of Rashko. And I'm sure you are aware of different layers histologically in pulp, right? So option A is right answer. Now let's move on to the next question. Second one. Periodontal ligament is thinnest at which part of root? Kernel third, middle third, apical third, all of the above. Yes, Ankur, I'm in Australia now. Okay, the second one is pertaining to the thickness of periodontal ligament. You might have heard the fact that Histologically, periodontal ligament thickness ranges between 0.15 to 0.38 mm. So, based on this question, in which part of root do you think periodontal ligament is thinnest comparatively? Yeah, the second one, periodontal ligament is thinnest at apical third of root, coronal third of root, middle third of root, uniform in thickness throughout. So I see a majority of you putting option C or middle third. Can anyone explain why it's middle third, why not coronal third or apical third? Is there any specific reason? And you're right, periodontal ligament is thinnest in the middle third of the root. However, as a range we give or we state that the histological thickness is between 0.15 to 0.38 mm. And this thickness of periodontal ligament is, or it largely depends upon the functional movements of tooth. And when you compare a functional tooth with a non-functional tooth or embedded tooth, the thickness of periodontal ligament is obviously thickest in case of functional tooth rather than the embedded tooth. And in those teeth where there are excessive occlusal forces, the thickness of periodontal ligament further increases, which means the thickness of periodontal ligament is not standardized or it's not the same throughout, depending upon the functional forces or the occlusal forces that act. There can be a varying range of thickness, right? So that's the take-home message. Yes, Akila, I'm trying to put my voice to maximum extent. Anyways, I suggest you to use earphones if you're finding it difficult to hear. Yeah, earphones, that would be the best choice. Ankur, the thickness of periodontal ligament is thinnest in middle third and it has nothing to do with the mesiodistal width of the tooth. Anyways, do find out there is a physiological reason behind that. If anyone is interested, you can just get back through mail for further discussion, right? So middle third of root is the right answer. Okay? Yeah, before I proceed with third question, guys, do give me your feedback. Do you want me to raise my voice even further or is this fine? I'm trying maximum to raise my voice, but at the same time, I have to make sure that I don't disturb others who are sleeping here. It's almost 1 a.m. That's the reason why I'm trying to level my voice to a particular extent. Yeah, with headphones it's going to be absolutely fine. Yeah. Okay, Sarijana, thank you. Also, I'll try to put maximum voice possible. So, third question. Which of the following is not an autoimmune disease? I'll give you some options. Do let me know which among the following is not an autoimmune disease. Systemic lupus erythematosus, Sjogren's syndrome, Wegener's granulomatosis, polyarthritis nodosa, none of the above. So you have the question in the comment section for your convenience, you can go through it. So which of the following is not an autoimmune disease? Also, I have just updated the title of this video. You can find that I have added please use earphones in the title. Okay, thank you. So which among the following is not an autoimmune disease? SLE, Sjogren's syndrome, Wegener's granulomatosis, polyarthritis nodosa, none of the above. See, we have different range of autoimmune diseases where the body's immune system attacks the so-called self. So it can be generalized or it can be localized. So generalized examples are all those which I have mentioned in this particular question. A, B, C and D, all of them are examples of generalized autoimmune disease. Localized autoimmune disease, you have some best known examples like type 1 diabetes mellitus, idiopathic thrombocytopenic purpura and whatnot. We have various localized forms which attack or which involve particular components of human body. Hashimoto's, Graves' disease, type 1 diabetes mellitus, Crohn's disease, myasthenia gravis. You might have heard of all these things, right? So these are specific entities involving localized or specific organs. And the examples of the options which I have given you are systemic or generalized autoimmune diseases, right? So none is right answer. Okay, good, well done. Now let's move on to penultimate question, fourth one. Let's see how many of you would do it right. Fourth question, anthracosis is a condition which is seen due to deposition of which of the following? Option A, anthrax virus. Option B, silica. Option C, lead. Option D, none. So anthracosis is a condition which is seen due to deposition of which of the following? Anthrax virus, silica, lead, none. Yes, Abhishek, the cause of Wegener's is mentioned as unknown or it's even mentioned as autoimmune in general pathology. Also idiopathic thrombocytopenic purpura, as the name itself indicates, it is idiopathic, unknown, but most probably there could be autoimmune antibodies which can be demonstrated in the patient, autoimmune cells which can be demonstrated in the patient. Usually we term them as idiopathic, but autoimmune role could also probably play some key role in the etiopathogenesis of that particular disease or lesion. So fourth one, anthracosis is a condition which is seen due to deposition of anthrax virus, silica, lead, none of the above. So I see majority of you choosing option D, none. You're right. So what is anthracosis exactly? So as Rahul rightly said, anthracosis is deposition of carbon particles. You know, we have exhaled pigments which do enter body and exogenous pigments, right? I'm sorry, I said exhaled. It's exogenous pigments which enter body from the outside sources, and these exogenous pigments can enter either through inhalation, inoculation or ingestion. Anthracosis is because of deposition of carbon particles which enter the body through inhalation. Usually asymptomatic and there is no inflammation or any disease associated with this specific condition. It's because of deposition of carbon particles. Option D, none, is right answer. Good. Yeah, it's a form of pneumoconiosis as Ramya rightly mentioned. Exactly, Nahida. Lakshmi, it seems to be streaming fine. You say it's not streaming. Okay, the final question of today's session. I have framed this question based on the videos which I have uploaded to e-classes very recently, based on the molecular methods which are employed in diagnostic pathology. So the fifth question, which of the following molecular methods doesn't involve extraction of DNA in diagnostic pathology? Option A, in situ or in situ hybridization. Option B, filter hybridization. Option C, polymerase chain reaction. Option D, all of the above. You can find the same in the comment section now. So this question is based on the molecular methods which are employed in diagnostic pathology. Which of the following molecular methods doesn't involve extraction of DNA? In situ or in situ hybridization, filter hybridization, polymerase chain reaction, none of the above. So I have discussed about the same in the form of these respective videos in general path section of e-classes. You can find more information about them in e-classes, right? So which among the following is right answer? So as the name itself indicates, in situ or in American in situ hybridization, as it is in place. So you don't extract nucleic acids or DNA or RNA from the cell, rather we try to analyze the nucleic acid which is present within the target specimen by using labeled probes. It can be radioactive labeled or non-radioactive labeled probes, which I have already discussed in detail in e-classes, right? So as you rightly mentioned, option A is right answer. Okay. So since you're all telling me that my voice is not audible and all, I'll try to raise my voice now and I'll try to revise all the questions which we have discussed so far. Okay. Option A is right answer. In rest of the options, B and C, we try to extract DNA and analyze the nucleic acid, desired nucleic acid, and we have various or varying range of applications of these molecular methods in diagnostic pathology, which we have discussed already. So those are joined late, and for those who couldn't hear what I was speaking out, so I'll raise my voice and I'll try to revise all the questions once and for all. So first question, plexus of Rashko is formed by myelinated, non-myelinated, both, none of the above. So you know there are several types of nerve fibers. Myelinated nerve fibers are associated with saltatory transmission, A delta fibers which perceive sharp pain, whereas non-myelinated nerve fibers, they are associated with slow conduction and they perceive slow or dull pain, isn't it? So myelinated nerve fibers lose myelin sheath and form plexus, which is called as plexus of Rashko. Refer histology of pulp, you will get more information. Second question, periodontal ligament is thinnest in which part of the root? Apical, coronal, middle or uniform? So in middle third of the root, you find periodontal ligament which is the thinnest. And there is a specific reason for it, specific physiological reason for it, to find out and get back through mail for discussion, right? It has something to do with the movement of tooth. Third question, which of the following is not an autoimmune disease? I have given you a few options like systemic lupus erythematosus, Sjogren's syndrome, vaginal granulomatosis and polyarthritis nodosa, all of which are general or systemic autoimmune diseases. Also we have various localized autoimmune diseases like Hashimoto's, type 1 diabetes mellitus, Crohn's disease, myasthenia gravis, etc. Right? Fourth or penultimate question, anthracosis is a condition which is seen due to deposition of carbon particles through inhalation. So these are exogenous pigments, right? And there is no associated injury or tissue reaction usually, because almost every one of us have carbon particles within our lungs, deposited in our lungs, because we do inhale a lot of pollution, isn't it? And final question, I've asked you about a molecular method which doesn't involve extraction of DNA. In situ or in situ hybridization, filter hybridization and PCR, or all of the above. As you all rightly said, in situ or in situ hybridization is the right answer. We're trying to analyze the nucleic acid in situ, intact in the cell. So option A is right answer, right? I hope it's clear. And I hope I'm comparatively audible. Anyways, use your headphones for better quality or better appreciation. Okay. Okay guys, so regarding the second question I've left one question unanswered, in the sense I haven't explained you why PDL is thinnest in the middle third of the root. So if any one of you is interested, do refer literature and get back through mail for discussion. Okay, so let's conclude the session and we'll see you again Sunday in our book reading session. We're going to have another interesting topic coming up this Sunday, and also we'll have some general interaction, and I'll make sure that I raise my voice and speak out to maximum extent possible. Maximum allowed possible. Okay guys, right. So see you again this Sunday. So schedule will be as usual, and you have any further queries, any further questions, to get back through mail 24/7. And as I keep on saying, it's all about giving your best each and every moment. See, you have attended this live session and you have actively involved in discussion, all 50 members, right? So all you need to do is just involve and make sure that you enter all relevant points which we have discussed in your customized notes, right? And this definitely helps. So imagine you're going to have hundreds and hundreds of live discussions, study club discussions, and having a separate notes for all these discussions will help you enormously. Blindly take my word. I'm sure you're following the same, and for any further queries, for any further tips or tricks or whatever you feel like, you can always approach through mail, right? So wish you all the best, love you all, and as I keep on saying, it's all about giving your best each and every moment. So wish you all the best, love you all, bye, good night. Yeah, Lakshmi, right now I'm in Australia. Yeah. So we're going to have the next book reading session from Australia itself. And I'm sure you're all missing toffee. Even we are. You're welcome, Sujay, Abhishek, Ramya, Lakshmi, Abhishek, Rakshita, Papiya, Gauri, Rohit, Sweetita, Tirtha, Pranav, Sangeeta, Vinita, Pandit. Yes. Yes, Rahil, Arijit. Ramak, you can just drop a mail. I'll let you know when I'm returning back. Yes, Lakshmi. Okay. Bye. Take care.